Okay, so when any big company decides to go all in on a digital transformation, the promise is always the same, right? It's efficiency, speed, innovation.
Right. Easy stuff to draw on a whiteboard.
Exactly. But what happens when you try to implement that transformation inside, say, a pharmaceutical manufacturing plant, a really highly regulated GMP environment?
That's where it gets complicated. Suddenly, every single system change, every new process, it carries this immense weight of regulatory scrutiny and, of course, patient safety.
And that's the reality we're diving into. We see these, strategic digital plans fall apart. And it's not because the tech failed.
No, not at all. It's because the organization itself, the people, the culture, the existing procedures just couldn't adapt.
So our mission today is to really try and isolate the playbook that works. How do you bridge that gap successfully?
We're looking at how the pharma sector takes these proven change management frameworks, the ones that work in any industry, and really custom tailors them.
Bends them to fit.
Exactly. So they can sustain change without, you know, jeopardizing those critical compliance standards. We're talking ICHQ-10, FDA quality maturity guidelines, all of it.
Because if you ignore that structured approach, the consequences can be, well, catastrophic in this space.
Oh, absolutely. The sources we looked at are clear. Without a solid methodology, even a small upgrade like, say, moving from paper to electronic logbooks can trigger huge risks.
What kind of risks are we talking about?
Things like deviation backlogs, what they call KP inflation, where your corrective actions just spiral out of control, and inevitably regulatory findings.
So the problem we're tackling is that this digital ambition, it often just collapses on these weak human foundations.
We need to see how change moves from, I don't know, an idea in a boardroom to something real and measurable on the manufacturing floor.
Let's start with the frameworks then.
Yeah.
The sources point to two big models that act as kind of the structural pillars here, one for the individual and one for the organization.
And both have to be woven directly into the pharmaceutical quality system, the PQS.
Okay, so for the individual employee's journey, what's the go-to model?
It's heavily based on the ADKAR model. That's an acronym for awareness, desire, knowledge, ability, and reinforcement.
ADKR. And why is that one such a good fit here?
Because those 5 steps map really, really neatly onto the existing pharmaceutical life cycle gates. It just slots right in.
But you can't just use the generic version of ADKAR, can you? The regulations must change things.
No, you're right. The regulatory needs force these crucial adaptations at almost every single stage. Take awareness.
Okay.
In a normal company, it might just be, hey, new software is coming. In pharma, awareness has to include the regulatory implications, the data integrity rules, and crucially, the patient safety reason why you're making the change.
So it's not just what is changing, but why it's compliant and necessary.
Exactly. Then you get to knowledge and ability, and that's where training gets serious.
Validated, I imagine.
Yes. Knowledge is understanding the new process.
Right.
But ability, that's demonstrating you can actually do it, deviation-free. And that has to include validation skills, GMP compliance, all specific to the new system. It's not just competence, it's validated competence.
Documented competence. And then reinforcement is what makes it stick.
Correct. And reinforcement has to be part of the quality culture. Leaders recognize and reward good adoption, not just, ticking a box for training. And that whole loop, the performance data, gets fed back into the TPA system and the PQS management review.
So it's locked into the quality system forever.
That's the goal.
So ADKAR handles the individual, but the whole organization needs a different kind of push, especially with these super long timelines, and that's where Kotter's 8-step model comes in.
Right. Kotter is about the big picture, creating urgency, building a guiding coalition, and maybe most critically here, generating short-term wins.
Why are those short-term wins so important?
It's about combating fatigue. I mean, some of these enterprise system validations can stretch out over 5 years, or even more. Without some wins along the way, people just get cynical and give up.
I have to ask about that first step, though. Creating urgency. This industry is so conservative, so risk-averse by design. Doesn't trying to create a sense of panic just backfire?
That is the tightrope walk, absolutely. You have to balance it very carefully. It's not about telling people the sky is falling.
So what is it about?
It's about demonstrating how the new digital way doesn't just speed things up, but how it actually reduces risk, how it enhances data integrity, how it's a better way to ensure patient safety. The urgency comes from the danger of standing still.
That sets us up perfectly to talk about the barriers, because if you can't create that positive sense of urgency, you just hit a wall.
And this is where the data gets really counterintuitive, because the single biggest obstacle isn't the technology. It's not the budget.
It's human resistance?
It's human resistant.
I mean, the number in this source is staggering. It says 51% of industry professionals cite resistance to change as the number one obstacle. More than half.
It's huge.
Yeah.
And it seems to contradict everything we think about an industry built on scientific precision.
So why? Why is the psychological hurdle so high?
I think it's the cost of certainty. The whole industry runs on the mantra, if it ain't broke, don't fix it. Because every single change introduces risk. So the resistance is baked into the culture of risk aversion itself.
And when you look at the other barriers, it really highlights how dominant these cultural issues are. I mean, budget constraints, sure, that's high at 35%, but right behind it.
Are the psychological ones? You see risk aversion itself at 31%, and then cultural or organizational inertia at 28%. If you add all those human factors up, they just dwarf the technical issues.
And what's really fascinating to me is that regulatory compliance, which you'd think would be the top barrier, is actually lower on the list. It's only 22%.
That's a great point. It suggests that organizations feel like they can comply, they have the knowledge, but they just struggle with the internal will to actually make the change.
And what about the skills gap? Is it that people just don't know how to use the new tech?
That's part of it, but it's a smaller part than you'd think. The skills gap is only cited by 17% of people. So it's less about can they learn it and more about will they accept the discomfort of changing.
Which means the solutions have to be cultural, not just technical.
Exactly. You need targeted tactics. A big one is early role-based storytelling. You have to stop talking about digital strategy.
And start talking to a technician about what?
About how this new system is going to make it less likely they get pulled into a deviation that keeps them at the plant until midnight. You change the story from this is a hassle to this makes our work and our quality better.
I also really like the emphasis on these peer-led job shadow pilots. It seems like a smart way to build trust.
It is. It closes that gap between, work is imagined by the IT guys and work is done on the shop floor. It proves the concept in the real world.
And then you reinforce it with clear recognition schemes tied to actual quality outcomes, like a period with 0 deviations after adoption.
Right. It sends the message that this new digital way is the new quality standard.
All of this points to the first practical step then. Before you buy anything, you have to assess where you stand. The organizational readiness assessment.
You skip that, and you're almost guaranteeing schedule overruns and problems down the line.
And for pharma, this assessment is multi-layered. It's not just about your server.
No, not at all. The first layer is your organizational culture and quality maturity. You're benchmarking yourself against industry standards, like ISPE surveys, or even the FDA's quality maturity model.
Okay, so you measure your culture. What's next?
Then you look at your raw digital capabilities. The tech, the processes, management commitment, all of it. And after that, you use customized change readiness tools built for GMP variables.
Like what?
Like, are your people truly data integrity literate? Do they have the competencies to validate a cloud-based system? You have to get that specific.
And this assessment gives you your starting point on that 5-stage digital maturity roadmap.
Right, which starts at stage 1, pre-digital, basically all manual, all paper, very little integration.
And the goal is to get to stage 3. Integrated.
Stage 3 is a huge milestone. That's where silos come down, data flows freely, and digital becomes a real strategic priority. The ultimate goal, of course, is stage 5.
Which is?
Optimized. That's where you see AI, autonomous decision-making in manufacturing, where digital is your competitive advantage.
That's the vision. But let's hit the listener with a reality check here, because this was a big aha moment for me. The industry average digital maturity score right now is just 57.
Which sounds... Okay, it puts them in the good category, but it's right at the bottom of that range. It shows a systemic lag.
And when you compare pharma to other regulated industries, it really stands out.
It does. Using McKinsey's digital quotient, pharma scores a mere 27 out of 100.
27, wow. They are trailing sectors like banking, which is at 32, and insurance at 31.
So even other industries with heavy compliance burdens are moving faster.
And that low score really dictates the timeline for the final phase, the actual implementation. These are not sprints.
No, they're marathons. Because you're dealing with validated systems and that cautious culture, you're looking at multi-year projects, often 5 years, maybe more.
Which makes those short-term wins we talked about with Kotter absolutely non-negotiable.
You have to deliver visible, tangible value in the first 6 to 12 months, or you lose people. You have to maintain that long-term vision while still giving them something now.
And what would an example of an early win be?
Something with immediate relief. Electronic logbooks, maybe, or deviation e-forms. Things can get rid of cumbersome paper.
With a clear success metric, like a 30% cut in cycle time for reporting a deviation, something people can feel.
Exactly. That's what builds momentum for the really heavy lifts, the true game changers, which are further down the road.
You mean things like AI-enabled release by exception?
Right. Where QA shifts from reviewing a batch report to assessing parameters in real time. That's in the 36-month plus horizon. The metric there is real-time release, a total transformation.
Managing a process this long and complex must require airtight governance from day one.
You need everyone at the table early: QA, regulatory, IT, and especially the operators from the shop floor.
The sources mentioned a best practice for the steering committee that I thought was really smart.
The alternating chairs.
Yes, why is that so important?
It's about balance. You have a chair from quality assurance alternating with a chair from operations.
So 1 month the compliance expert is in charge, the next month it's the workflow expert.
Pretty much. It stops the project from becoming compliant but unusable, or usable but non-compliant. You need both perspectives leading.
And you also need to empower the change control board to fast-track low-risk tweaks. You can't get bogged down in bureaucracy.
That kills momentum faster than anything. And this leads to the final step, which is sustaining the change. It's cyclical, not a one-and-done project.
So after you go live, the work isn't over.
Not even close. Those new KPIs, your lower deviation volumes, your adoption rates, they have to feed directly back into the PQS management review cycle.
The continuous improvement loop.
Exactly. It lets you recalibrate in real time instead of waiting a year to find out something's broken. This is how change management becomes just how you operate.
And it becomes sustainable when you start celebrating successes tied to zero observation audits. That's the proof.
It proves that the new digital way is both efficient and compliant.
So what this all boils down to is that change management has to move from being this abstract idea into a validated metric-driven discipline in pharma.
And you do that by merging those general frameworks, ADKAR and Kotter, with a specific compliance pillars like ICH-Q10.
So for you, the listener, what's the key takeaway here?
I think the core challenge is understanding that digital transformation isn't about buying software. It's about systematically integrating new systems and processes into your existing, highly structured quality management system.
You can't treat them as separate projects.
Never. Every single digital move has to enhance, not compromise, your core compliance with things like 21 CFR Part 11 for electronic records, and above all else, patient safety.
And that brings us to a final provocative thought that comes right out of the data. We talked about the slow industry average, but the source also noted a widening gap.
A huge gap, yeah, between the digital leaders who are scoring much higher on maturity and the laggards who are stuck years behind.
And that gap is accelerating. So the question for you to think about is this. If the biggest barriers are cultural inertia at 28% and risk aversion at 31%,
how long can those laggards afford to prioritize their traditional view of risk mitigation over embracing digital transformation? The data suggests these new systems aren't just faster, they're a superior form of risk enhancement for patient safety. That competitive pressure is only going to grow.